surgery is always the last resort, except in a very few circumstances where there are really obvious, objective findings on exams, like Amanda mentioned, like central sleep apnea from brainstem compression, or dysphagia where patients are aspirating actively, or a scoliosis that's worsened dramatically in a short period of time. Those are all objective measures that we can look at and decide upon and make recommendations for surgery. Most of the patients, however, actually fall into the subjective category, where they're coming to us with symptoms that only they experience, and that might be dizziness or ringing in their ears that's debilitating, that we can't assess on an exam. It might be pain that they perceive in a different way, as being detrimental to their quality of life than we perceive in a 30-minute office visit. So it usually, it's the rare patient where they come to the office and we actually talk about surgery on the first visit. And so that makes this kind of a unique field. But pain is central to almost everyone's conversation in one way or another. And so to get back to the topic of pain, headaches are probably present in about 80 to 90% of our patients to some degree. Some patients can live with it and it's not debilitating. It's just that sharp kind of tussive headache that goes away after 3 or 4 seconds. And some people live with chronic pain that we really need to sort out. And those are the patients that need neurology and pain management, because it's highly likely that surgery is not going to eradicate the pain. And that's echoing what Amanda said. Success and pain management, it's not something that we have great outcome measures on that everyone agrees upon. My favorite outcome measure is, are you happy that you had the surgery? Would you do it again? Do you think it's made a difference in your quality of life? Those are the things that really resonate. And, the same exact surgery can, improve someone's pain 50%, and they could be ecstatic with that after having failed therapies for years. And some other people may feel, disappointed in that outcome, that they've only improved 50%. And so the best we can do is, create realistic expectations, create a really comprehensive preoperative plan to make sure we haven't missed anything, and then involve all the experts here on the screen so that we, give them the experience that can maximize their recovery and give them the best chance of that outcome.